Example 1, yin not controlling yang. So a very common case is heart yin deficiency, paroxysmal tachycardia. So the tower diagram will show us a typical case of chronic yin deficiency. So with chronic yin deficiency, there is recurrent hyperactivity or hypersensitivity of yang. Then the yang returns to its normal state after some time. Treatment. So heart yin deficiency during the chronic state, no major symptoms. The treatment would be different compared with that who is symptomatic. So we tonify the heart yin. We use the REN 14, the move front point, and heart 5, the luo connecting point. And the common point would be do 20 and pericardium 6. Now for heart yin deficiency and yang excess during tachycardia, in which the patient is very symptomatic. So we tonify the yin, sedate the yang. We use heart 5, luo connecting point, and REN 14 as well. But we sedate SI4, the yuan source point. And the common point for both conditions would be do 20 and pericardium 6. Second example, we have yin not controlling the yang. An example is one-sided recurrent migraine headache, which is liver or gallbladder yin deficiency. So on the first tower diagram, the patient is easily nervous or tense, quick to get angry, dry eyes, nails. So this is a chronic issue. So we tonify the liver, gallbladder yin, and then we use liver 5, which is the luo connecting point, and move front point, which is gallbladder 24. Now, if you have a strong headache, so we have here a symptomatic patient, photophobia, vomiting, sound irritability. So this is a person who hates, who is very sensitive to noises. So we tonify the yin and sedate the yang. So subacute. Now liver 5 is the luo connecting point. And in addition, we use, we sedate gallbladder 40, which is the yuan source point. And of course, we use gallbladder 24, which is a move front point. Third example, for lack of control, yang does not control the yin. So we have recurrent edema, kidney qi deficiency. So chronic functional deficiency of the kidneys, which is kidney qi deficiency, and this causes recurrent yin retention, because this is someone who will have difficulty will retain water, will retain fluids. So there would be edema. So because of the yin retention, the patient develops edema. So the approach should be different for the chronic state and the recurrent state. So chronic state, we have cold feet, backache during rest, poor hearing. We tonify the kidney yang, and we use bladder 23, the back shoe point of the kidney, and we tonify using bladder 67, tonify the bladder. And we use the yuan source point of the kidney, which is kidney 3. Recurrent state, if mild edema only in the ankles, if bad, so edema in all joints or the whole body. So we have to sedate the kidney yin, tonify the yang. So we needle bladder 23 and cup. Bladder 58, luo connecting point, and then we sedate kidney 3, which is the yuan source point. And finally, we have example 4. Yang does not control the yin. Classic case of bronchial asthma, which is lung qi deficiency. Chronic state is different. The approach should be different also for recurrent state. So for the chronic state, we have history of asthma in wet and cold weather, shallow breathing. and the patient would be easily breathless, poor sense of smell, low skin sensitivity, and melancholic. Treatment, tonify lang yang and qi. Then we use bladder 13, the Bakshu point of the lung, and Li 11, lung 10, Ren 17, moxa. So for the recurrent state, cough and asthmatic breathing are worse at nights and early mornings in bed, congestion of chest, excessive frothy white mucus, excessive cold sweating, light-colored semi-solid stools. So we tonify lang yang and qi, sedate the yin, sedate lung 5, Li 6, luo connecting point, and the Bakshu point of the lung, which is the bladder 13 and stomach 40. So common points for both chronic state and recurrent state, we have pericardium 6, Ren 22, extra 17, which is the Ding Chuan, the calming asthma point.